Thanks for joining us on Medwatch today. I'm Vanessa Villafuerte. Did you know that celiac disease affects millions of Americans, yet many don't even realize they have it? We meet one local woman who says getting a diagnosis changed her life, and now knowing the signs made all the difference in her health. An estimated 1 in 133 Americans has celiac disease, but many people don't know what symptoms to look for.
Celiac disease is actually an allergy to gluten. It's an autoimmune condition where the gluten actually creates an allergic reaction in the small intestine, where the lining of the small intestine starts changing and flattening. When that happens, all these nutrients cannot get absorbed, and people start having a lot of different symptoms, a whole slew of symptoms that are both systemic and then just related to the gut as well.
Those symptoms can range from bloating to abdominal pain and even brain fog.
A lot of people complain of some brain fog because different nutrients are just not getting absorbed.
A diagnosis is made through blood work and an endoscopy to check the small intestine. But if celiac disease is left untreated, it can lead to serious health complications, even cancer.
Other than just the complaints that patients have, if the patient is not diagnosed in time and continues to have that constant inflammation in the gut, it actually increases the risk of a small intestine cancer called T-cell lymphoma, which is actually very specific in celiac disease.
For Dr. Mitroo's patient, Rachel Devoll, getting answers was life-changing.
When I had my follow-up with her, she confirmed that it was celiac disease. She walked me through what I needed to do, and it was definitely eye-opening. And I started to just change my diet and do gluten-free. And then we did a follow-up 6 months after to see how I was doing, and I did another endoscopy, and all of the ulcers were gone. She said I did an excellent job in changing my diet and being able to get on the path to be more healthy, especially, if you don't treat it, it can lead to some terrible things.
Rachel says the diagnosis not only improved her health, but her mentality as well.
I still have some fatigue, but I think that's just being a mom. But I do feel a lot better. So it's definitely made a difference as far as me feeling, up to doing things. 'Cause when you have an undiagnosed issue with your gut that you don't know about, it's something you don't realize how it affects you. And so with having the diagnosis and knowing that I need to do this in order to be healthy, it just really helps your overall mental health as well.
And she's found some help from her smartphone.
I did actually also get an app that I can scan a barcode at the grocery store, and it will tell me yes or no. It will tell me if the item's not found, but instead of having to really read through ingredients. And so I only buy ones that have the green light.
Dr. Mitroo says a gluten-free diet is the only effective treatment, and an early diagnosis can prevent health issues in the long run.
Over the years, we've seen an increased incidence of celiac disease because there's a genetic component to it. So there were a lot of people that had the genes, but now with more and more gluten exposure, it's in more and more of our products, we're actually seeing that we see it in about 1% of the population, which is a lot of people in the U.S.
So Dr. Mitroo says if you think you might have celiac disease, it's best to talk to your doctor so they can do a blood test. It could be the first step toward getting answers and better health.